I'm Saigal. I'm a neurosurgeon here at Washington Hospital, and I have subspecialty training in spine surgery. Today we're here to talk about back pain, some common myths surrounding back pain, and when spine surgery is necessary. There's quite a few common conditions that cause a patient to need spine surgery. The most common reason that we operate on patients is for a condition called spinal stenosis. Basically, that's narrowing around the nerves in the spinal canal. You might think of it as a pinched nerve, which can either be in the center of the spinal canal or off on the side when the nerve is starting to leave the spine. That can cause back, plus or minus leg pain, and that again would be the most common reason that we operate. Besides spinal stenosis, other possible reasons someone might need back surgery would be if they have instability in the spine. That could be from degeneration, from something they were born with. It could be from a car accident. Other reasons might be cancer that spreads to the spine, or a spinal deformity such as scoliosis or kyphosis, where the spine is curved and bending in a way that causes pain to the patient. There are other red flags that would cause someone to need to see a spine surgeon, or maybe have advanced imaging to see if there's a problem in the spine itself. So, for example, if someone has not only back pain, but back pain that then radiates down the legs, that could be a sign that a nerve is pinched in the back. Or neck pain that radiates down the arms, that could indicate a similar problem in the neck. If someone has a new difficulty with walking, such that their balance is off, or if they have difficulty using the bathroom, such that they can't empty their bladder or they can't control that the way they used to, any of those conditions could indicate that there's a problem in the spine and that a spine surgeon may be needed as part of the treatment. So what are some of the conditions that don't indicate a need for spine surgery? First, let me say, many people have back pain, particularly low back pain. Most of us will have low back pain at some point in our lives. And most patients with low back pain don't need spine surgery. So, for example, many people will have some sort of musculoskeletal strain, maybe lifting something heavier than they normally would, maybe using bad posture in their everyday activities, maybe some extra weight that they're carrying that leads to low back strain. So there are many types of strain and causes of low back pain for which there's no spinal instability, for which no nerves are pinched, and which spine surgery is really not necessary. In those cases, we can frequently help a patient by doing what we call conservative measures. Those might be things like engaging in an exercise program, losing weight to try to maintain a healthy body habitus, eating well, and just having good ergonomics at work and at home. So an important question is when someone who has low back pain should see a spine surgeon. Most patients who have low back pain only really should just start out with their primary care physician. And that primary care physician would often prescribe some of the conservative measures I just mentioned. Again, simple things, anti-inflammatories, healthy lifestyle, ergonomics, rest at times, exercise. I get the question a lot about what can patients do to prevent back pain, back problems, or if they already have back pain, how can they keep it from getting worse? You want to sit like I'm sitting now. Sit upright, try to look straight forward, rather than this common position of bending forward that we unfortunately live a lot of our electronic lives in now. So ergonomics can go a long way. Lifting in a healthy manner, meaning with the legs and not with the back, is important. And then doing some exercise to keep your body healthy and trim and fit is also helpful for warding off back and spine issues. Part of my philosophy of spine surgery is making sure we try non-surgical measures first, making sure we select our patients well, and making sure the patients have the best chance of success. Don't be afraid to seek medical advice if you do have low back pain, and just because you do, many times we'll have treatment options for you that don't involve surgery.